Good afternoon, this is Dr. Do again. This video is alphabetic list of problems and we're on the letter C. I finished letter A and B. Letter C, I start with chest pain. So the first video, chest pain, talk about the emergency situation. Since I brought up the chest pain, so the second video just finish the chest pain with those non-emergency condition that can cause chest pain. Today, we're still on the C list. Today, I'm going to talk about not specific condition or disease, but in general, I like to talk about the compliance. What compliance? Compliance, what the significance for your compliance with your medical advice. For example, you went to the physician office, you have the GERD, like gastric esophageal reflux syndrome, or you have some, and you're detected with some bacteria, H. pylori, for example, and the physician prescribe you medication, either 4 or 3, and ask you to take at least 4 to 6 weeks. And probably after 2 weeks, you feel better and you stopped. So, and then this will impose the recurrence, the risk of recurrence. So then, since you did not follow the advice from your physician, and then you stopped the medication at the middle, and because you feel better, I understand, and the physicians also understand, but this increased the risk of recurrence. So each of the regimen or the advice from our prescription medication your doctor prescribed to you, there is some data, evidence-based. Most of the cases are evidence-based medicine. So there has been studies either from the pharmaceutical company or from the physician recommended those regimens and for medications, and in terms of time, those time are the best, the optimal, the minimum. So that's the one example for the compliance. These are, since the GERD, gastric esophageal regurgitation, this is a case of minor. I mean, it can be serious, but usually it's not very compared to the heart condition, for example, arrhythmia or hypertension, diabetes. Since those conditions are chronic lung cause, if you miss the medication or if you did not follow the physician's advice, in other words, not compliant with the prescription, that holds the high risk for the worst consequences. So, for example, blood pressure medication. Usually, there's a guideline for how to start blood pressure medication. For example, if you're newly diagnosed hypertension, the diuretics, hydrochlorothiazide. So this usually start first line, or some people just jump into beta blocker. This HCTZ, hydrochlorothiazide, is particularly for some people, for example, African American, that has been studied, has been strongly evidenced data to support that what kind of people, what kind of hypertension start with what kind of medication. So if that's the case, if you're diagnosed for high blood pressure and your doctor advises you to follow the lifestyle, it seems not important because you probably think that's not medical, but it is really critical in order to manage your blood pressure and to decrease the further complications. So start from the modify your lifestyle to comply with your physician's advice. And then your doctor prescribe your medication, for example, beta blocker. You start from beta blocker. And either once a day or twice a day, depends on what medication your doctor give you. By the way, in terms of medication, probably some people take beta blocker, one of them. The other people take another kind of beta blockers. There's a variety of them. This is based on the physician's preferences, or I'm sure each medication has the unique character, unique nature. Some of them are short-acting or last longer, for example. So whatever your physician chose to start you with, you need, if you have questions, of course, discuss with the physician. Otherwise, just follow the advice and follow the medication dose, the schedule, either once a day or twice a day, or the length of the treatment. And if you think your blood pressure back to normal, you want to stop, then before you do that, call your physician to discuss. Ask the physician, hey, Dr. blah blah, for example, Dr. Doe, I have been on this beta blocker, for example, I've been on this beta blocker for a while, and now I think my blood pressure is normal. Can I stop it? So you call your physician think if they think your request is reasonable, bring you in. Okay, yeah, sure. Why don't you just come in? I'll just double check, make sure everything is okay. Then we'll discuss from there, either stop or continue. So this is one example for the high blood pressure. And some of them even have more than one medications. If your blood pressure is hard to control, if your lifestyle is not modified, you continue with stress, so your blood pressure is not controlled, and your physician probably add another medication. So 2 or 3 medications. I understand that's not easy. You manage your life, you manage your medication, particularly some medication has different schedules, so you need to make sure morning, evening, and take the right medication at the right time. So I'm sure your physician educated you very well, give you a detailed plan, how to take it, what time to take it. Then if you're not clear, ask your physician write down for you. Usually they do, they give you the handout, or you read it and write down for you, and what time you take what. So that's give you the detailed advice for the physician part. For your part, you just follow it. If you have questions or if you have difficulty, just discuss with your physician. If, for example, you probably think, can I have the medication just take at evening once a day for all the medications? If there is a case like this, if your physician thinks it's possible, based on your disease, your condition, and the medication character or medication nature, if it's possible, all the physicians, they're there to try to help you. Their job is to make your life easier and convenient for you. If there's a case they can do this, they will. But however, a lot of time it's not like what we think. Or just do like, okay, we can do that. A lot of time, each of medication has a long list of the side effect, the best, the clearance, the best way to take it, the best time to take it. So this, I'm sure each physician knows this. So the decision was not just prompt made, was made based on the evidence, the data, and the guidelines. So this is, for example, diabetes. I just talked about the high blood pressure. Diabetes, of course, after you're screened or after you're suspected to have diabetes and tested either blood glucose random or empty stomach or glucose challenge test, and you were diagnosed as diabetes. And usually the first line is, of course, lifestyle modification, exercise, lose weight. Usually diabetes, probably if you're diagnosed at 40, 50 years old, you know that it's overweight. So your physician recommends you to lose weight, modify lifestyle, and then start some medication, for example, metformin. And then after a couple months, and on the recheck, okay, return to the clinic, follow up, and then your blood sugar back to normal. Hallelujah, congratulations. But your physician said, since you're still overweight, you might have a chance to, the sugar will go up if you stop medication. So continue to prescribe medication. However, you think, oh, my blood sugar is normal now, probably I can stop. So you stopped at home, and you did not feel anything, because usually at the early stage of diabetes, there's no quite symptoms. Usually just very subtle, you cannot feel anything. So you think your blood sugar is controlled, you stop medication, and then suddenly there's something happened. Because the long-term high blood glucose has very bad consequences generalized from the eye, the brain, the nerve system, the heart. So all the impact eventually will probably suddenly have some serious complications. So that's the significance. What I like to talk to you is to compliant. with your physicians. Otherwise, if you have questions or concerns, call them before you do any change. If you want to change the doses, you want to change your schedule, call them. Unless you're yourself is a physician, that's a different story, right? So, but if you're not, you're patient, even though you know a lot of knowledge, but still, like I said, each medication, each regimen, each schedule has a data evidence-based majority of case. So that's my advice for this video of my recommendation and what I meant to talk on the C-list compliance with your medical advice. Thank you for watching, and I'll see you next time.